To another episode of Let's Talk with Dr. Celeste, MD. I am Dr. Celeste and excited to share with you on this Sunday afternoon another one of my favorite health topics. Today's topic is vitamin D. So we're going to give a few minutes to allow some people a chance to climb on board. And today what we're going to talk about is, okay, what is vitamin D? What is it? Why does it matter? If you are out there listening, please don't hesitate to share this with family or friends, anyone who you think could benefit from this information. If you are watching this in replay, we would ask that if you would please type in the comment section hashtag and replay. So we'll give it a few minutes. It's a beautiful Sunday afternoon, and what better time to discuss one of the favorite topics, vitamin D. Hey Celeste, how are you? Thank you for joining us. And Celeste, that's a friend of my name, Celeste. My name is Celeste as well. So just clarifying that, because that would seem weird to be saying that to myself. But hey Celeste, how are you? Thank you for tuning in. We are talking about vitamin D today. It is a vitamin, and so we're going to talk about why we care about it. Why do we care about vitamin D? Why are you bothering me with this conversation today? So we'll give it a few minutes to allow a few people a chance to climb on board. We're going live both on Facebook as well as Instagram. Again, I'm Dr. Celeste, MD, your board-certified family medicine physician and urgent care specialist. Excited to talk about vitamin D, yet another one of my favorite topics. We will give it just a few more minutes to allow a few people a chance to climb on board. Feel free to tag family and friends in this Facebook and Instagram Live to share this information with whomever you think could benefit from it. So we'll give it a few more minutes and get talking about vitamin D. And why does it matter that it's a bright, sunny day in Birmingham and that we're talking about vitamin D? Let's talk about that. Okay. So we'll give it a few more minutes. Hello, Mr. Willis. That's my husband. He's watching. Hey, babe, thanks for joining me. Who's so supportive. We're talking about vitamin D. Okay, so we're going to go ahead and get started. Hello, ladies and gentlemen. My name is Dr. Celeste, MD. I am your board-certified family medicine physician as well as urgent care specialist. I've been serving the Birmingham area for the last 14 years in the area of urgent care and general medicine. I assist busy moms on the go and professionals with their both acute and general medicine care needs. And today's topic for our Facebook Live, we've been doing this for the past couple of months, each Sunday, just taking a few minutes of your time to try and share a topic that we think could be enlightening, something that could benefit you. It may benefit you, it may benefit your family or your friends. So today's topic is vitamin D. Why do we care about vitamin D? What is so important? So let's talk about it. So vitamin D is a prohormone that is synthesized by your body when your skin is exposed to the sun. So vitamin D is something that's very beneficial in helping your body to absorb both phosphorus as well as calcium. These are two minerals that are very integral in the formation of strong bones. So increased vitamin D levels help us to increase our absorption of calcium and phosphorus and make us have strong bones and strong teeth. Now that serves us at a point, we think anyway, later on in life. So that's what vitamin D is. So where do we get vitamin D from? So let's talk about a few ways where we get vitamin D from. Hey Danielle, how are you? So where do we get vitamin D from? We get it from our skin. We get it from our food, and we get it from supplementation. What is the recommended daily allowance of vitamin D? For individuals that are 1 year old to 70 years old, it's 600 international units of vitamin D a day. For people that are 71 years old or greater, it's 800 international units of vitamin D every day. So those are the daily requirements. For people that are deficient in vitamin D, what happens, or why do we care about that? Well, for people that are deficient in vitamin D, they may have soft, brittle, or thin bones. Now, for individuals that have severe vitamin D deficiency in children, there's a condition known as Rickets. And so sometimes with these children, the bones will be so soft, they'll be like a bowing of the bones. This is something that actually is common in the African American community. So severe deficiency in vitamin D in children is called rickets. In adults, severe vitamin D deficiency is called osteomalacia. So let's talk about some of the foods. Hi, Dr. Dietrich. How are you? Thank you for joining. So let's talk about some of the foods that are high in vitamin D. So, okay, we talked about skin and how we get it from sunlight exposure. Let's talk about foods that are high in vitamin D. So foods that are high in vitamin D would be fatty fishes like tuna, salmon, mackerel. In addition to that, high amounts of vitamin D are found in egg yolks, in dairy products, in cereal, in soy milk, as well as in beef liver. So all of those are foods that are high in vitamin D. So you say, Dr. Celeste, okay, so you've told me what vitamin D is, you've told me what happens or what foods I need to have or intake to have an adequate amount of it. So what am I going to feel like, let's say if my vitamin D is low, if you're suffering from vitamin D deficiency? Well, so a lot of times patients that come in suffering from fatigue, vitamin D is one of the levels that we check. In addition to your thyroid level, of course, in other labs, we'll check your vitamin D level. That's because people that have vitamin D deficiency tend to suffer with fatigue as well as with tiredness. And a lot of times when you replenish that vitamin D, that feeling of fatigue and tiredness goes away. In addition to having complaints of fatigue and tiredness, someone with vitamin D deficiency may complain of bone pain or having muscle pain or having muscle aches. They also can complain of hair loss as well as bone loss as well as impaired wound healing. In addition to that, they can suffer with depression. So those are a lot of reasons why it's important to pay attention to our vitamin D level. So you say to me, okay, Dr. Celeste, so what do I do to check my vitamin D level? See your regular physician, they will check that for you. Now, what do I need to do if my vitamin D level is low? So the first thing that I would tell you is to make sure that you spend time in the sunlight. In particular, for certain groups of individuals, there are certain groups of individuals that are more likely to develop vitamin D deficiency, including African Americans, including people that stay in northern latitudes, including people that are homebound, people that have jobs that do not allow you to have adequate exposure to sunlight, like people that work the night shift, people that work in situations, let's say if there was a military man, let's say in the Navy, and you spend all of your time in the submarine all day, you're not exposed to the sun. So these are groups or individuals of people more likely to have that decrease in vitamin D. So let's go back. We said that African Americans are more likely to have vitamin D deficiency. Why is that? Well, that is directly related to skin tone or the melanin, specifically in my particular instance. So people that have a darker pigmentation or have darker melanin do not absorb the UV rays as much because of the darker pigmentation in the skin. So what this means is that when African Americans go outside in an attempt to increase the vitamin D level, we may have to spend a little bit more time outside in the sun to get adequate vitamin D production. And so with that, now what I do find interesting though is that researchers have found that even though African Americans are more likely to have a decreased vitamin D level, that they are also more likely to have a decreased risk of other cultures of having an osteoporotic fracture. And they attribute that to having increased bone density and an increase in muscle mass. And so that's why it's important to replace our vitamin D or make sure that our levels are adequate. So let's go back over that. Vitamin D is a prohormone that's synthesized, that is made when your skin is exposed to the sun. We care about it because we do not want dry, brittle bones that are more likely to allow you to have a fracture. And in addition to that, there are different ways and things that we can do in an effort to try and supplement for that vitamin D, which include going out and spending at least 15 minutes in the sun at least 3 days a week. In addition to that, making egg yolks a part of your diet, making fatty fish like tuna and salmon a part of your diet, and in addition to that, supplementing it if it's needed. I encourage you to do that, and if I may be transparent with you, if that's okay, I will share with you this story of something that happened to me a few years ago. an active person. I work out, I take vitamins, minerals. A snowstorm occurred in 2014 that it basically shut down the city of Birmingham. And I ended up getting stranded, tried to walk over an overpass, fell and broke my hip. My vitamin D level was a level 19. Normal is 30 to 100. So my decreased vitamin D level increased the risk of me suffering a stroke when I fell. Now, did I have any other underlying diseases or illnesses or anything that attributed to that? No, the vitamin D was the only thing. So I share that with you in an effort to help you maximize and maintain your optimal health and wellness by getting your vitamin D checked. Getting your vitamin D checked is a tiny, tiny way that can lead to something very lucrative in your overall health and wellness and well-being. So that's all we have to share with you guys today. Next week's topic is vitamin D, African Americans, cancer, and diabetes. How are all these interrelated, and why does your vitamin D level matter if you fall into one of those groups? We'll be discussing that on next Sunday. Thank you so much again for tuning in. We appreciate it. Please feel free to share this video with any of your family, friends, coworkers, anyone who you think would benefit from this. And in addition to that, we would ask you to tune in and follow us both on Instagram and on Facebook at facebook.com/Dr. Celeste MD. That's facebook.com DoctorCelestemD. And Instagram, same handle, Dr. Celeste MD. Thank you so much for tuning in. I hope this information is helpful for you, and I hope the things that we've been sharing are very helpful for you. And we will see you next week. Go outside in the sunlight and get some vitamin D. Have a good day, everybody. Bye.